Morning, everybody. Thank you for being here with us this morning. It's great to have everybody here in support of Councilmember Sheng Thao's resolution in the Oakland City Council to support WIPA. So we're really grateful today to have representatives from NARAL Pro-Choice California and Planned Parenthood Marmonte, in addition to a staff member from our Congressmember Barbara Lee, a original co-sponsor of this. So first, I'd like to introduce Shannon Olivieri-Hovis, who is the director of NARAL Pro-Choice California. Shannon is a policy expert and political strategist who has spent the last 15 years fighting for civil and human rights as a senior policy advisor to then Attorney General Kamala Harris in state and local governments, in the classroom, electoral campaigns, and mission-driven advocacy. Thanks so much for being here, Shannon.
Thank you. Good morning, everybody. Thank you for the introduction, Julie. As Julie mentioned, my name is Shannon Olivieri-Hovis, and I'm the director for NARAL Pro-Choice California, representing our nearly 300,000 members all across this state. NARAL is the oldest and largest abortion rights advocacy organization in the country, and we are really proud to be here today alongside Oakland City Councilmember, President Pro Tem Sheng Thao, and others in support of the Women's Health Protection Act. I want to be clear off the bat. 2021 has been the worst year for abortion rights on record. At the beginning of this month, the Supreme Court allowed Texas's draconian ban on abortion to go into effect, putting abortion all but out of reach for millions of Texans, and I'm sure you're all aware of that. Later this year, the Supreme Court is slated to take up Mississippi's 15-week abortion ban, which is a direct threat to Roe v. Wade. And even here in California, just last week, we saw anti-choice extremists try to come to our state with the attempt to recall reproductive freedom champion Governor Gavin Newsom. The stakes here could not be higher. If Roe v. Wade falls, in short order, abortion could be outlawed in approximately half of the United States. If Roe falls, millions upon millions of people could have the right to legal abortion and self-determination, a right that they have accepted and known that they would have for the last 50 years stripped from them. So now is the time for Congress to act. Congress can and must take action immediately to pass the Women's Health Protection Act, which would enshrine a federal right to abortion and ensure that there is improved abortion access all across this country. It would prevent states like Texas from passing these kinds of extreme bans and prevent them from passing medically unnecessary restrictions like they've done time and time again. 8 in 10 Americans supports the right to legal abortion. 8 in 10 Americans. So that is not just a majority. We are truly talking about a consensus. And this critical legislation would bring us closer to a world where all people can make personal, important decisions about their own health, lives, their families, and their futures, free from any measure of political influence. So we are grateful today to Oakland City Council President Pro Tem Sheng Thao for introducing this important resolution, and we look forward to seeing the House pass the Women's Health Protection Act off of the floor later this week. Thank you. Julie, I'll turn it back to you.
Thank you so much. In addition, we're really appreciative that Planned Parenthood is here. We have Dr. Jessica Hamilton, who joined Planned Parenthood in May as the Associate Medical Director of Abortion Services for Planned Parenthood Marmonte, excuse me. She's trained as a family medicine physician and brings many years of experience in family planning, data-driven quality improvement, and healthcare leadership. Thank you for being here, Dr. Hamilton.
Thank you for the introduction, Julie, and thank you for inviting me here today. As Julie mentioned, my name is Dr. Hamilton. I am the Associate Medical Director of Abortion Services for Planned Parenthood Marmonte. We are seeing a rash of abortion restrictions sweeping the country. State lawmakers, emboldened by the new makeup of the Supreme Court, are rushing to control patients' rights to health care. On September 1st, the Supreme Court allowed Texas's 6-week abortion ban to go into effect. In just over a month, we anticipate that the Supreme Court could hear a Mississippi case that could render Roe v. Wade meaningless. There are 17 states with abortion bans that could go into effect if Roe v. Wade were overturned. At Planned Parenthood Marmonte, we are actively preparing for a post-Roe world. As this wave of restrictions spreads throughout the country, California has been a beacon of hope for people seeking abortions. This is because our leaders understand that abortion care is healthcare and is a personal matter that should be left to a patient and their healthcare provider. Just last year, 7,000 patients came from out of state seeking care at Planned Parenthood health centers in California. In the months ahead, we will continue to see more and more patients traveling here for care. As an abortion provider in this state and in this city, I am so grateful that my patients have your support. Just last week, I took care of a mother of 4. She had traveled from out of state to see us. She had just found out that she was 7 weeks pregnant. She had been unable to maintain a job due to the increasing needs of her children during the pandemic. She was sick from early pregnancy and having an increasingly difficult time caring for her family. This is a tough decision for her. She loves being a mom, but also knows that she cannot support another child. This patient had traveled to escape many obstacles to abortion in her own city, and she was able to find refuge in Oakland. While traveling here was not easy, needing to pay for airfare and patch together care for her children while she was away, I felt so fortunate to be able to support this woman and provide safe, compassionate, and comprehensive healthcare. In addition, I was so thankful that this care is accessible to our own community, thanks to your support. At Planned Parenthood Marmonte, we care for patients in the Bay Area through the Central Valley and Northern Nevada. I travel throughout a wide and socio-politically diverse landscape to provide care. I can tell you that the City of Oakland's support is palpable within our local health center. Your support meaningfully impacts care on an individual patient level. Thank you, Councilmember Thao and your fellow council members for declaring Oakland's support for abortion access. We at Planned Parenthood are prepared to continue to provide the same comprehensive health care to all of the patients who come through our doors, no matter what. Thank you.
Thank you so much, Dr. Hamilton, and for sharing how tangible and important this is. We appreciate having here today as well Alex Katz, who is the communication manager in Congresswoman Barbara Lee's Oakland office. As we all know, Congresswoman Lee is a champion of many important civil rights, including reproductive rights. She's an original co-sponsor of the Women's Health Protection Act, WIPA, and the co-chair of the Pro-Choice Caucus. So thank you so much for being here, Alex Katz, on behalf of Congresswoman Lee.
Thank you for the introduction. Thank you, Councilmember Thao, for this resolution supporting WIPA. Congresswoman Lee could not join in person today as she is in Washington, D.C. to vote on this bill and others, but she asked me to read this statement. So here's the statement. Thank you, Councilmember Thao. Thank you to NARAL, thank you to Planned Parenthood and everyone else in the City of Oakland for your support of this critical bill. As the co-chair of the Pro-Choice Caucus, I'm proud to support my friend Congresswoman Judy Chu's bill, the Women's Health Protection Act, WIPA. This bill will protect the right to access abortion and address the attacks on abortion rights happening throughout the country, and I look forward to voting to pass it in the House this week. The right to reproductive freedom is essential, and we have a long way to go around the world and in our own country to secure this right. Extreme and dangerous laws like SB 8 in Texas will harm people of low income and people of color the most. Restricting and banning abortion have made access near impossible. The right to abortion is not real if only some people can access it. It is also clearly unconstitutional and un-American to create a vigilante system that encourages you to turn in your family members, your neighbors, or anyone at all if you suspect they have exercised their right to have an abortion. It's time for Congress to protect abortion rights and access with the Women's Health Protection Act. The support of cities like Oakland, cities that have been on the front lines of the fight for reproductive freedom, will help us to get this across the finish line. Passing WIPA is a critical step toward creating a world where every person, regardless of their income or zip code, is free to make the best healthcare decisions for themselves, their families, and their futures. Thank you.
Thank you so much. We appreciate Congresswoman Lee's statement and your being here on her behalf. I now would like to introduce Council Member and Oakland President of the City Council Pro Tem Sheng Thao. Sheng Thao is the daughter of Hmong refugee parents and is the mother of a 14-year-old son. Sheng was first elected to represent Oakland's District 4 in November 2018 and took office in January 2019. Since being elected, Sheng has been elevated to council leadership as President Pro Tem and is on the statewide board of California Women Lead, as well as being the president of the API caucus of the California League of Cities, where she works to elevate the voices of API women everywhere.
Thank you, Julie, for that introduction. And, thank you, NARAL. Thank you, Congresswoman Lee, Congresswoman Barbara Lee's office and Planned Parenthood for joining us today. Again, my name is Sheng Thao, and I have the honor of representing the city of Oakland. It's a little bit emotional for me. This topic is so incredibly personal for me, and I'm honored and energized to be standing here with you all and the community leaders and Oaklanders who care so deeply about protecting women's right to choose. As a single mom, I can tell you from my personal experience that healthcare and family planning services provided by organizations like Planned Parenthood are a literal lifesaver for so many women in this country. Planned Parenthood was there for me personally when I needed them the most. And right now, a woman's right to control her own body is literally under assault, under attack in America like never before. We are seeing the laws like the one passed in Texas. They're posing a threat to women's health and reproductive freedom. And we must fight back with everything we've got and then some. And as a female elected official, I also have to say that there has never been a more urgent time than now to elect pro-choice women to office up and down the ballot, from city councils to the halls of Washington, because women with an unwavering commitment to protecting those essential rights is critical to our movement. So I am the proud author of the Oakland City Council's resolution in support of Congresswoman Judy Chu's and Congresswoman Barbara Lee's bill guaranteeing the right to safe and legal abortion in America. And I also urge my colleagues to support it as well. My legislation is also co-sponsored by Council President Nikki Fortunata Bass and Vice Mayor Kaplan as well. This is an incredibly emotional moment for me, because I can tell you as a survivor of domestic violence that having an opportunity to say what around my body and around what I want to do with my body is incredibly important, in the sense that when there is not, when you're in a situation where you feel like you can't control anything else, we need to still feel a sense of control over our own body, something that we live in, our own skin. And so because of that personal experience, and not just that, but because I know that other women's rights, how they feel like, this is the only opportunity at some point in their life that they can have actual control over whether or not, they would like to choose to have a family at a certain time, is incredibly important. So I urge everybody to please call the city council to have them pass this important bill. And not just that, but call upon your representative, your Congress people as well. And so from there, I'll open up to questions from our media.
Do we have any questions for Councilmember Thao or any of our panelists? Just giving it a moment to make sure nobody is being bashful. Okay, well, thank you again to Planned Parenthood. Dr. Hamilton, I am a mother of 4, so I find your story especially relatable. Thank you to Congresswoman Lee's office, to NARAL Pro-Choice California, to Planned Parenthood, to Councilmember Thao, for bringing this really important measure before the Oakland City Council and for enforcing for us with your advocacy why this is so needed by cities like Oakland and across the country. So
Yes.
thank you very
And
much.
I do want to add that this item will be heard at tomorrow's City Council meeting by the full council. And so if you would like to call in and dial in to speak on this, you can actually reach out to my office and we'll send you the directions. We're at District 4, that's the number 4 at oaklandca.gov. And District 4, that's the number 4 at oaklandca.gov. Tomorrow's City Council meeting will start at 1 p.m. And thank you all so much for joining us. Thank you to Alex Katz from Representative Barbara Lee's office. Thank you so much to Shannon and Jessica Hamilton as well for joining us. It is such a pleasure and I look forward to fighting with you alongside with all of you.
Thank you.
Thank you.